Hello nurses and future nurses, welcome back to my YouTube channel, and on today's episode of Nurse Clement B, I am going to teach you on how to make an occupied bed with patients on it, just the way this one is. So I'm going to make this bed with this patient on this bed. So please do not forget to like, share and subscribe to my YouTube channel at Nurse Clement B. Do not also forget to comment and drop any suggestion you want, right? So sit back and watch this video till the end, please. Thank you for your support. Thank you, my lovely students. Thank you very much. And nurses around the world, nurses around the world, thank you for your support. So before you make bed, of course you must set your requirements. These are my requirements for this bed. These are my requirements. You can even turn it this way according to use, right? So I have 2 bed sheets, 1 draw sheet, 1 draw Macintosh, 1 pillowcase, 1 blanket and pillow with glove, of course, and a duster that I can dust the bed if it's soiled. I can clean the bed if it's soiled. And also I have a laundry bag to remove soil, to remove old sheet or dirty sheet from the bed, and I will drop them here. Also, you must have 2 seats like this back to back in case the top sheets are clean, so you can fold them and put them here. So this is optional. If the sheets are not dirty, you can reuse them, and if the sheets are dirty, then you can change new ones, right? So remember, it's a 2 nurses procedure. So I'm going to get an assistant, so sit back. When I get an assistant, I'll go and wash and dry my hands and come and don glove with my assistant. So do not go away. I've done my glove. I've performed hand hygiene already. I've done my glove, me and my assistant. So we are ready to get started with this procedure. So remember, as the nurse that is making the bed, wheel the trolley to her side so that she can have easy access to the requirements, so that she can be picking them. So do not forget that in this kind of bed, the patient is there already, so you have to explain the procedure to the patient so that you can get full cooperation of the patient, right? So, and you have to introduce yourself. Remember the normal formula. So, good morning. I'm Nurse Clement B. Please, can you tell me your full name and your date of birth? Chukwuemeka Eze, right? So I'm here to change your bed linens. They are dirty, and while we are doing that, we'll be turning you left and right. Is that okay? So we need your full cooperation. Is that fine? So the patient says yes, and we'll go ahead and do that. Remember that you don't allow your patient to stay long one side because you are making bed, right? So let's go ahead. So me and my assistant, if these sheets are okay, do not forget not to cover your patient's face. Always leave your patient's face open, and remove the untuck all the sheets, the bottom sheets, untuck all of them, right? So what you have to do, if these top sheets are clean, then we reuse them. So this one, they are clean, and we fold them. We fold like this. So we place it. Remember, I said you can put 2 chairs back to back, and you place it on the chair. So the same thing with this one. You fold it and then fold this way, right? You fold this way. Me and my assistant, we fold and then we place it on the chair, same way. Now, I noticed that the patient is still on the bed. The patient is still on the bed. So I will try to give my assistant to this patient. Hold this patient towards your side, and then I quickly push the bed linens towards her side. And in case if the bed is soiled or if there is any fluid on the bed, I quickly clean it with this duster, my side. I quickly clean it, right? So you pick your sheets and make it this way. Make sure that you straight as the patient, to avoid the patient like staying long, so you have to bring immediately after you have pulled the on the sheet, right? So also, while the patient is still there, also pick the draw Macintosh and then unfold it this way, roll it this way, and also place the same time, right? Place it on the bed, pick draw sheet also, fold it this way, roll it, right? After rolling it this way, you also place it this way so that you not be turning your patient over and over again. So you can do it at once this way, at once, and then ask your assistant. Remember, we have old sheet here. You have pushed it under the patient and you have cleaned in case if there is any stain. We have cleaned with duster. Then you push this one also closer, right? So you push it this way and ask my assistant to give me back the patient and ask her to pull. My assistant roll the old sheet and also help me support this patient while she gives me the the dirty sheet. I drop it inside the laundry bag, right? So, and on my assistant continue unrolling. All right, then we put the patient back in a dorsal position, right? Then together with my assistant to make sure that the sheets are well spread on the bed, right? We straighten it, all the sheets, right? So after making sure that the sheets, then we start tucking in with from the foot end of the bed. We tuck in, making sure that we maintain our envelope corner, right? So we maintain our envelope corner. Then bring this one down and tuck it in. Okay, then we continue tucking it, the bottom sheets, right? And we tuck in the head end of the bed also. Make sure that whenever you are doing this, you work in harmony with your assistant. So the next step in making this bed, we are going to put the pillow, right? So remember, I have my own new pillow. We are going to change the old pillow. I give my assistant this pillow, the new pillow that we want to change. So you want to fix pillow and nursing, this is how we do it. Ask my assistant to pull the pillowcase. Always make sure that while you are making bed like this with the patient on it, make sure that the discussion between the two nurses includes the patient. You should not be discussing your family issues or your children issues while making bed, right? Discuss things with the patient, as in gist with the patient, right? Okay, then I lift the head of my patient or ask the patient to lift his or her head, and my assistant fix the new pillow, right? And I remove the old pillowcase, right? So my assistant, I can do it alone, or I allow my assistant to hold the pillow and I pull the pillowcase back and I discard it inside the laundry bag, and I collect this old one also and put it this way. The next step is for us now to place the top sheets. So placing the top sheets is either I use the old one that I removed that I clean, or I place the new ones, right? So you start with the bed sheet. Place it on the patient. You and your assistant together. You evenly spread the sheets, right? Do not cover your patient's face. Do not cover your patient's face while putting this, right? And you also place the blankets this way. Remember, the patient is still in bed, so you have to be careful and you have to be smart so that you will not make your patients too uncomfortable. So together with my assistant, we'll start tucking in the foot end of the bed again, join the blanket and the bed sheet together, maintain your envelope corner, make sure that the bed is neatly dressed, and together with your assistant also, ask the patient, does the patient want it this way to cover his or her body, or does the patient wants you to place the top sheet halfway on top of the patient's body? If the patient wants it halfway, if the patient doesn't want it this way, you leave it this way. But if the patient wants it halfway on his or her body, what you would do is that just to fold it backward, right? So my bed sheet is longer than the blanket, right? So we do it this way and then make our patient comfortable. So you can somehow, do not make it tight. Remember there is a patient on this bed. So this way you make the bed and make your patients comfortable, right? And also the foot end of the, pull it this way so that it's not be too tight. The patient can be moving his or her leg freely under the top sheet, right? So now that you are done, ask the patient if she wants this position, right? If she's comfortable. If the patient is comfortable, then you leave this patient at dorsal position. If the patient is not comfortable, then you change to left lateral or right lateral position, right? So now that we are done with this procedure, it's left for us now to discard. We push the discard used equipment, remove trolley away, and then remove gloves, right? Pinch this way and then squeeze and put your index finger under. Always be careful not to contaminate yourself after each procedure. Then you discard it immediately inside a bin, right? You discard it inside a bin and then you go and perform hand hygiene. Then you come and record what you did and what you observed while making this occupied bed with patients. Thank you for watching this video. Thank you for all your support. Please do not forget to like, share, and comment. Thank you very much. Bye-bye.